Okay, so my hand hygiene video didn't save for in the room, so I'm just gonna do it here. Turn on the water, make sure my clothes aren't touching the basin, nor should my hands ever touch the basin. Make sure it's warm. Get 1 pump of soap, is the manufacturer's recommendation, although this soap comes out really quickly, so I'm gonna do 2. We wanna scrub our hands. So, in between our fingers. And this is gonna be 20 seconds. And I go under my nails. And then I rinse off with my hands down, grab a paper towel, pat myself dry. Once I'm patted dry, we shut off the sink with this, and then I throw it away. Okay, I just did hand hygiene, now it's time to put on PPE. First grab my gown. I figure out how to put it on right way. Put your arms through. And tie it in the back. I like to tie it in the front, which means I'll have to change my process when getting it on. Next, I put on my mask. Here it is. So then I grab goggles on, and then I put on my clean gloves. And I make sure that the gloves, dang it. I make sure that the gloves cover the sleeves of the gown. That's all we got. Okay, I will go into the patient and I say, hello, my name is Morgan, Mrs. Smith. Please give me your name and date of birth, and I check that against the bandage or the armband band. And then I ask them, are you in any pain? Do you have any pain? Any medications? If they're in pain, I give them like a pain reliever, and then I come back within 30 minutes to or after 30 minutes to an hour. Then when I do come back, I close the curtains and the door. Then I worry about the trash can. I open the drawer trash can, so that's there. Don't remember where my bag is. Where's my bag? Oh, right here. Sorry. I gather the things I need for sterile field, which are an abdominal pad, 1 gauze, we need another gauze, 2nd gauze, we need our irrigation tray, we need the actual sterile field, our sterile gloves, our solution. Okay, that's great. And the solution and tape. Tape. Then I move the patient to a position where I can best care for him, which is at my height. I check to see if there's any lines, IV, etc. that I need to worry about. Then I put on gloves, but we PPE'd, so I have the gloves on. I show the wound area, making sure everything else is covered. And then I use the push-pull method, which is like pushing down and then pulling the tape back a little bit, pushing down, pulling the tape back, pushing down, pulling the tape back, pushing down, pulling the tape back, pushing down, pulling the tape back. I do the sides, both as this one wasn't on that well, so push down, pull it back, push down, pull it back, push down, pull it back. And then I take it in my hand and I examine the drainage, yeah. So we have an acronym for that. It's called PTACO. So presence, type of wound, amount of wound, color and odor. Depending on what the wound is, you know, you take that off. So then, receptacle. Now, now I assess the wound. And for that, we have another acronym, TEAN, SAD, GUS. So T is for tunneling. E is for epithelialization, presence of eschar, necrosis. SAD is stage, appearance, drainage. GUS is granularized tissue, undermining, and sinus tract. And then I measure the wound. Oh my gosh. Yeah, okay. I've got my swabs. So I grab one swab and I measure the length and the largest, or like the longest part. And that is about 10 centimeters. Then I do the width at the widest part. And that is about 2 centimeters. And then for depth, I put it in the deepest part of the wound and move my hands down to where the skin is. And that's about 1 centimeter. Okay. Oh yeah, and then I get rid of this guy. Then it's time to make my sterile field, I think. Yes, okay, great. Okay, sorry, this is sterile. So, oh, I have to take off my gloves first and perform hand hygiene. So take off the clean gloves, or throw them in the receptacle, this one. Perform hand hygiene again. Do you have to do it? Do you want, okay, yeah, I don't know. I will perform hand hygiene. Then I take the sterile field, I'm gonna step over a little bit here. I open it up, being sure to touch only the edges, or corners rather. Look at that. And we want the blue side to me. Also, I'm making sure not to put my back to the patient, I'm sorry. Okay. There's the field. Now I'll put all the stuff I need on it. I'll open things toward me, so I'm not putting my hand over things to like contaminate them. So irrigation tray, the cotton swab. We will open 2 gauzes, but we're only opening one for this purpose. One is like dried gauze. Oh, sorry, I'll open it toward me. And so we put the dry gauze on there, and we put that tray close to us. I would open this one and put that gauze next to it. My abdominal pad I need on here. And my solution. I also have to get some tape ready for the wound dressing. Okay. Then I put on my sterile gloves away from the sterile field. Drop them. No, sorry. Non-dominant hand. Into that one. And at this point, my hands are sterile. Now,
I would remove my mask.
I also, oh shoot, before I put on sterile gloves, I do pour this into the empty gauze container. I apologize. empty nose container for the sterile.
It's stuff to film.
Oh wait, so also, I did wrong. So I have to put the
I don't think, did we say that?
water in the container, and I also would have had to put the basin down before I put my sterile gloves. I apologize. Okay. Then we grab our syringe, scoop up some water or solution. Then when we're irrigating it, we want to make sure we're an inch above the top of it. So with my left hand, I'm touching the basin, so now that one's contaminated. And I irrigate the wound until like it runs clear. And sometimes I might have to get a second one. We'll deal with that later. Okay. So now I need to deal with putting wet gauze in there. So with the syringe, which I'll only use one hand, like I'll only use one finger, like one hand now to do it. I will get up the water and drop some on the gauze, so it's wet. Now to do this, we're going to take the sterile hand and pass the swab to the non-sterile hand. Take the wet gauze, scrunch it up so it's nice and damp, but you want to make sure you get most of the water out. And then for this, I'm going to push it in, push it in, push it in, push it in. Oh, sorry, that was not good. Okay. Hopefully that stays, yes. So, now I get rid of this. Then I take with my sterile hand 2 gauzes, and or dry gauzes, and kind of just like drop them on there. You don't want to get contaminated quite yet. And then I get my abdominal pad, blue side facing up, and now we're all contaminated. But that's fine. Get my tape. Put that on. That on. Okay. And I make sure to write the date, time, and my name on the abdominal pad. PPE carefully, I grab, or no, sorry, we start backwards. So first I have to untie this, because I tied it in the front, I don't want to contaminate myself. Then we go with gloves. We pinch the inner side of it, pull off, and then we get under the other glove and pull off. Put that in the trash. Then we have goggles. Put those down. Take off your mask, and then I tie the back of this. So I'm gonna try to get under here and pull that down. I'm not really good at that yet. And then I take the other arm, roll it up, toss it in the trash before I leave the